So some people experience discomfort with their wisdom teeth, and prior to that, there's a good chance they never even thought about wisdom teeth. So who has wisdom teeth? What are signs of discomfort and potentially that they may need to be removed? So to discuss this topic, we have Dr. Pashmini today with Serenity Dental. Welcome.
Thank you.
So wisdom teeth. Usually we don't think about it until we're feeling them. So help people to understand a little more about wisdom teeth and what they should know.
Sure. Well, I'll let you know that usually removal of the wisdom teeth is one of the key procedures everybody remembers. Any age you ask a patient, they
Myself included. Yeah.
vividly remember when and how they had their wisdom teeth removed. So, what are wisdom teeth? There are our third set of molars. They come in right around the age 15, 16 is when we start looking for them in our patients, in our young patients. They're the last set of molars you have all the way in the back. Some patients will be able to actually have these teeth come in on time with no problems. They erupt just like any other tooth and don't cause any issues. Those patients are completely fine and they can probably keep their wisdom teeth as long as they're not causing issues for them down the road. There are patients who have these wisdom teeth coming in at weird angles. They are pushing the teeth that we are actually using to chew. So we're trying to keep those teeth. A lot of times, if they're getting food trapped between the wisdom tooth, because again, it's coming in at a weird angle, then those are the times that we will recommend removal of the wisdom tooth. We don't want it half in, half out. If you have a tooth that's halfway in, but the rest of it is covered with gum tissue, then we would like that removed because all that's happening is bacteria is getting under that gum tissue. That's usually when patients experience pain and infection because they keep biting on that piece of tissue in the back of the mouth and then it gets swollen. That was the case for myself when I had my lower wisdom teeth removed is just infection after infection and antibiotics after antibiotics, and you're like, you know what, at some point we got to get those babies out. So the sooner we get them out, the easier. Usually the roots are a lot shorter when patients are younger.
Hmm.
As we grow older, these roots also grow longer and they get more difficult to remove. In some cases, they're not possible to be removed, especially if they're very close to the nerve. We have a main nerve that goes down our lower jaw, and a lot of the complex cases are the roots that are literally hugging that nerve. So it will require to be seen by an actual oral surgeon to get those removed. Sometimes we have to leave the roots in. So they're kind of a complicated set of teeth, but more and more people are evolving out of them because they are kind of structures that we don't use anymore. So some patients have four, like we expect them to have. Some patients have two. Some patients have none. And some patients have an extra one or two. So
Wow.
if you're one of the really lucky ones, you'll have some extra ones in there. So
Wow. Well, that's definitely a lot to know about wisdom teeth. Again, these are topics that usually we don't think about until it's front and center. So very informative, a lot to know, and I'm sure a lot of people will benefit from this. So appreciate your time and insight on wisdom teeth, Dr. Peshman.
of course, thank you.
Great. Have a good day. Thanks.
You too. Bye bye.